Let's find out a little bit more about public support and whether or not it is fraying. We've got members of the public here. Hello, welcome to the programme. Hi, good morning. And we've got two junior doctors here who are on strike today. Good morning to you. I know you're all going to introduce yourselves, but tell us if you are supporting this escalation of the junior doctors' strike. Good morning.
Hi, I'm Nikki Thompson. I support the junior doctors, but I'm struggling with the morals around the strike today. So at the moment I'm anti-strike, but actually supportive of the doctors generally.
You're anti-strike, but broadly speaking you support the junior docs. Yes. Hi, hello.
Hi there, I'm Izzy Barnard. I'm in the same position as well. I do support the doctors and everything that they're doing, but at the same time striking for the NHS, acts in emergency departments is slightly worrying.
Slightly worrying?
Yeah.
Okay, how would you describe it? Hello, good morning.
Hello, good morning. I'm Lucy Booth, I'm a patient and I fully support the doctor's strike. I think there has been an element of scaremongering today from the government to say that patients are going to suffer. I think actually patients will suffer in the long term if Jeremy Hunt doesn't back down on this.
The beeping of the horns would suggest that there are quite a lot of motorists right now on the road up to Westminster Bridge who are supporting our junior doctors. Hi, good morning.
Hello, I'm Phil Taylor. I'm at a stage, or my parents are at a stage of life where they have extended stays in the hospital, and on their behalf and mine, I'm not supportive of the strike. I mean, obviously one supports medical service, and that's wonderful, but not necessarily the strike. And
okay. Hi.
Hi, my name is Ash Chetri, and I am a teacher and also a neuroscience graduate. And much like teachers, I believe doctors are the pillars of society, which is why I am fully in support.
I'm sorry,
That's all right.
Over the sound of the horns. Are you still supporting junior doctors or not?
Absolutely.
Yes.
I'm fully in support of the junior doctors.
Seeing your badge. Hello, hi. What about you?
Hi, I'm Danielle. I'm a student nurse and I wholeheartedly support the junior doctors because they're fighting for each and every one of us in this country. They're fighting for their colleagues, they're fighting for patients. The only people that are risking patient safety are the Conservative government with their chronic underfunding and cuts to the NHS. There's been more operations cancelled by their underfunding than there has today, and each and every one of us has to get behind the junior doctors and support them before we lose the NHS forever.
Okay, hi.
Hello Sam, I'm Sam and I'm a law student from North Yorkshire, and I'm completely against strikes. I think they're absolutely childish, pathetic, and they ought to go and get back to what they're good at and serve some people's lives instead of cancelling 110,000 appointments and 13,000 operations today. I think it's an absolute disgrace for the taxpayers of this country who rely on appointments every day, and they've been cancelled, and they probably won't get another appointment for another 6 months.
Well, we've got two striking junior doctors here. I mean, do you want to accept that invitation? Do you want to go back to work right now?
We are at work right now. We are doing a very important duty, fulfilling a very important duty, which is protecting all of the patients in the NHS in the future. I don't think I so understand why people would be frightened today about this strike. My mum was in hospital on one of the strike days, and I fully trusted my colleagues to look after her, and they did. And what I would say is the thing that I am most afraid of as a patient and as a family member, you know, my parents have been in hospital, they're also elderly, they rely on the NHS, is what is going to happen to our NHS if this toxic contract is imposed on all doctors from this August. That is my biggest worry, and that's what everybody needs to be frightened of the most.
The government, the Health Secretary, Jeremy Hunt, he seems to be taking no notice of what you're doing, even this escalation. So what you're doing, according to the government, is not going to work.
I think that Jeremy Hunt needs to take a step back and listen to the voices of the public.
There is no sign that he's doing that.
I think that Jeremy Hunt will have to listen. He is the Secretary of State. His position is to listen to the public, to ensure that we have a health service that is able to support the public. He will have to listen to us. I do not believe that Jeremy Hunt truly wants the destruction of the NHS. I think that he needs to work with us.
This new contract would not destroy the NHS. I mean, that is completely over the top.
I think that this contract will be the steps towards the destruction of the NHS.
Let's hear a conversation between our members of Parliament. You'll have to gather in. Come on.
Just on the contrary to that, I don't think Jeremy Hunt is against the NHS whatsoever. The public are on the junior doctor's side for now, but when they realise that the dispute is all about money, it's nothing to do with patient safety. Patient safety it's got to be about safety.
I'm not
because
going to suffer a pay cut under this contract. Why am I on strike
the
today?
amount
My
of
pay is not
working
going to be
hours, the maximum working hours under the current contract is 91 hours. Under the new contract, it's 72 hours. So if it was about patient safety, the junior doctors, your counterparts, would have
about the 72 hours.
disputed the original contract.
At the moment, as things stand, on a yearly basis, our trusts have to make sure that we work to the amount of hours, the maximum number of hours. The government in this new contract will be removing those safety guidances that keep us safe, but also keep the patient safe. So you're saying that there's going to be a 72-hour cap. How do we know? How does anyone know that there will be the 72 hours?
Phil, you're saying that's a technical point.
Well, it is a very technical point. I'm not sure.
Not for a junior doctor who works many hours and is worried about.
Well, the mechanism, I'm sure, could be refined. What they're essentially saying is you don't agree, and it must be technically right in every detail before we go any further ahead. I mean, I'd like to get back to the 7-day thing, because the 7-day thing has been consistently misrepresented by the junior doctors who say, oh, we provide a 7-day emergency service. Well, that's not what it's about, and it's not either about elective services 7 days a week. In the 7-day, in the 5-year forward view, in Simon Stevens' vision of how the NHS could continue, which was not a political vision, was the 5-year forward view said, let us provide 7 days a week services where they're required, where they're clinically required, and that's what the 7-day thing is about.
That's what it says in the 5-day forward, is to get rid of the doctors, completely change our health service and privatise it. And actually, how can you provide?
Get rid of the doctors.
It's true. It's true. Read it. And another thing, how can you provide a 7-day service if you're chronically underfunding the system?
Could I just say, people say we don't have a 24/7 NHS. We have a 24/7 NHS when it really matters. I personally have had to go into hospital for life or death situations. I've called my nurses, I've called the emergency contact numbers that I have, and I've been seen as quickly as humanly possible. We have a 24/7 NHS when it really matters,
That's
when
great,
it's life
and
or death.
that's great.
And I
That's
do not think that we should be. I do not think that we should be fed a fallacy that we don't already have a 24/7 NHS.
I was going to say, my experience of the 7-day service wasn't quite as good as that, unfortunately. My mother-in-law died of cancer 2 years ago through a series of errors, mainly waiting far too long to be diagnosed. When she did get the diagnosis, the surgery did not go according to plan, as we've been told, and the aftercare was appalling. And when she fell ill on the weekend, often the weekend shifts, the staff themselves told me, try not to bring in on a Saturday, we call it the graveyard shift. And some of the care that she got from registrars and other doctors who were on at the weekend was not the same standard and the same level to how it had been during the week. We didn't have handover properly, the briefings weren't done properly. And we're in a day and age where we need 7-day care, and no one's disputing you should be paid to do that.
My name's Rudy. I'm a cancer specialist. I'm a junior doctor. I've been a junior doctor for 10 years, and I completely understand the concerns that people have about weekend care and how we can go about improving the function of the NHS, but we need more doctors to do that. We need more doctors on shifts, every shift, to provide the care, not just from an elective point of view, because the government hasn't even told us what it means by a 7-day service. Is it talking about an emergency? But we're not talking about the Simon Stevens 5-year forward view. We're talking about the government manifesto of 7-day services.
Can I ask you? Almost all junior doctors I speak to say this is not about Saturday pay. The government is offering extra pay after 5 p.m. on a Saturday. The BMA wants everyone who works all day Saturday to be paid at 50% above the basic rate. It's disingenuous to say it's not partly about Saturday pay, isn't it?
It's not about pay for me at all. My pay is not going to change at all under this new contract. I would not be going to these lengths if it was about pay, and I know that that is the case for many doctors. It is true that actually there are a significant proportion of doctors who will suffer a pay cut. Not a single person is going to be getting more pay from this contract, I don't believe.
Well, they will if they work regular weekends.
There is going to be an increase in the number of shifts in the weekends and in the evenings, and there are no extra doctors to fill those shifts.
And that's the issue. It's trying to
doctors short,
and the government knows
and
that.
we cannot fill our shifts as it is. And they want to introduce more shifts without any more doctors. What that means is there is more patients per doctor. That is not safe.
You will be stretched too thinly over the 7
There are already
days.
6,000 vacancies, rota vacancies, as we sit here. The fact is that if you spread us thinner, those rota gaps are going to get worse.
It won't be possible to
No,
spread you
it's
more
physically
thinly.
impossible.
So actually, your rotas won't change that much come August.
What will happen is I get emails almost daily begging for shift cover. And as doctors, sometimes we feel that if we don't go in and provide that cover, you know, who's going to do it? So doctors go in and they do extra work because they feel that they have to, and that's going to increase. And we can't do that. We're human, and it's going to break doctors. Doctors are going to leave. We're going to lose more and more doctors from the NHS, and it's going to become an impossible situation. And I think this is going to be a catastrophe. I would consider resigning because I cannot provide safe care if this contract goes through, and I will not be party to a process that endangers my patients.
The contracts are going to be sent out in May. I understand some of the contracts will be sent out in May. I mean, if yours arrives in your inbox, you will do what?
The contracts are due to be imposed from August.
Yes, but they have to be sent out before that, don't they?
They should not be sending out contracts before August, and if that is happening, we need to question who is authorising that process.
Okay.
But there's no other option, is there, when you're being childish and having a picket line here?
I think Jeremy Hunt is being incredibly childish because he could have avoided this strike
No.
by stopping the imposition.
Jeremy Hunt
It was
has been
very simple.
negotiating with the GMA, and the only issue left is the Saturday
It's
fair.
not the only
So
issue
that's
left.
indicating to me that it is about 100% about pay.
Okay, I'm going to read some
Jeremy's
messages.
letter
Sorry to interrupt. Sorry. I'm going to read some messages from people who are watching you talk about this around the country. This email from Caroline: as a member of the public, I'm entirely behind the junior doctors' strike. The government have deliberately pushed the doctors to this point in the hope that the public will withdraw their support as it impacts upon them. This email from Rupert: the root cause of this entire crisis is due to funding of the NHS. This tweet from Paul: I'm a specialist nurse in A&E, covering gaps left by striking doctors today. Our pay has been frozen for 5 years. And this from Claire: she has been nursing for 42 years. Junior doctors have my full support. Thank you all very much. Thank you very much for coming on the programme. Thank you.